The study that I've seen mentioned that I thought was just so unbelievable that there's no way that this is real. And the claim was all you have to do is jump up and down 10 times a day to fix your bone density. When we talk about physical activity, we'll kind of go in the reverse order here. We'll talk about a study that I've seen mentioned that I thought was just so unbelievable that there's no way that this is real. And the claim was all you have to do is jump up and down 10 times a day to fix your bone density. And I thought that seems like a very minimal stimulus. So we looked at the data, and there was a statistically significant difference between women who were jumping up and down and women who were in the control group. But the control group was losing bone density at an unprecedented rate in that study. And the changes were very small, I believe less than a 1% effect size. And it was within a very small time frame. At 8 weeks and 16 weeks, they checked the bone density. And realistically, if you're managing someone, probably no more often than every 6 months, probably best if you're doing it every 12 months to really get a gauge on how things are trending. So I thought it was interesting. I would consider this a bit of a passive-aggressive statement by the authors of the study. There were a significant number of participants that dropped out or did not complete their assigned jumping. And the authors said, apparently, jumping 20 times twice daily and waiting 30 seconds between jumps required too much time and effort from subjects. So I found that little gem in there and figured we'd throw it in because it's a bit comical.
Yeah, I like that a lot. I guess the control group had also either stopped their strontium before the study or maybe started GH. So there's very likely confounders to this study, but it's a decent start, I guess you could say. And this, by the way, this is maximal effort jumping, not necessarily jumping high. It wasn't jump rope where your feet are barely coming off the ground. They wanted them to jump high. And I believe we looked into the materials and methods, and they didn't have them squat all the way down, because it'd be nice if it was, a body weight, at least parallel squat, if not ATG, and then jump all the way up and down. But it's not necessarily translatable if you're going to do jump ropes and barely come off the ground.
Yeah, exactly. You need to have a stimulus there. So this is the example of a jumping stimulus that was used in a longer 8-month trial. This is actually called the Lift More trial, LIFTMOR, which I think is a great name.
Yep.
It's called impact loading. And a portion of this was what they called jumping chin-ups. So the person would grab a bar and then they would jump off of a box, and then they were instructed to, they jump up, lower themselves, and land as heavily and comfortably as possible, which sounds like a bit of an oxymoron.
Yeah, so putting as much weight on the ground and not the bar as possible, but maintaining comfort. That's an interesting one. So things to keep in mind. Where is the weight? Which plane is the weight going into? Is it going into the axial plane? Is it going to the sagittal plane? Whatnot? And yeah, that jumps out at you. That they're doing things that specifically load weight axially.
Yeah, and some of the other movements, they show the same thing, right?
Yeah, so deadlift, overhead press, and back squat, things that you would think of. Maybe not overhead press. Deadlifts, or certainly open trap bar deadlifts, is one of our favorite lower injury, high return on investment for stockpiling bone.
Absolutely. And, even if you're sitting on a leg press with 800 pounds on it, that's not going to do much for your lumbar spine. Great for the femurs, probably.
Yeah.
And the change they saw, again, small study, but a pretty intensive trial over 8 months. They saw, there was a, lumbar spine loss of about 1.2% in the control group, and in the high intensity resistance training group doing the jumping chin-ups, they had about a 3% improvement in their lumbar. Looks like about a smaller improvement in the femoral neck, 0.3%, but that's compared to a 2% loss in the control group.
Yeah, that was quite a bit of loss. A decent enough data here, although I think that there's in addition to this review, in our non-systematic review, there's a whole bunch of other articles that support similar protocols for both improving and maintaining bone density.
Yeah, and you definitely want to start sooner rather than later, stockpiling bone. Never too late to start, but the sooner the better. And as we've mentioned in our past, I believe our synthetic estrogens and synthetic hormone replacement podcast, we talked about the effect of oral contraceptives on peak bone mineral density. So be sure to check that one out.